Hello, good evening. I'm still David Michael Smingy, and my wife still has a brain tumor question mark. Um, so I know last time we gave an update, it was quite a while ago, about a month or so, a month and a half ago, Britta was starting her second cycle of chemotherapy, and she has since completed that cycle. And then we're all kind of anxious, like, well, what's going to happen to Britta's tumor when she's on chemo? How's it going to respond to chemotherapy? So we had an MRI done a few days ago that looked and tried to answer that question, and it was mostly encouraging. I can't really. It was pretty good. Still some questions, and questions I'll try to explain. So, if you imagine a brain, all right, brain. This will be the right side of your brain, left side of your brain. What happened is Britta had a big tumor when she um, presented in 2016 with her first seizure, and along that we had this big resection that we took out, and I'm realizing now that this might be backwards on the video, but you'll get the idea, and this is actually kind of a poetic way. It's kind of how radiologists look at their scans anyway. So, um, anyway, we took this big chunk of brain out. All right, so if you imagine like this would be eyes up here, kind of ears back here, looking top down. Big chunk of brain lost. So we lost a lot of premotor stuff and then motor cortex right back here. And then we waited a little while to see what happened, and then Britta's tumor recurred. So we did another scan, and that asked the question, well, where is the tumor growing back? So the tumor that grew back essentially grew along motor cortex back here, and then grew essentially along this kind of cavity, and then into the other side of her frontal lobe where you do a bunch of thinking. And then also kind of grew along this bottom, if you imagine, kind of take out a big chunk of brain on the bottom edge of that. All this sort of just looked crummy, okay? So we were able to take out, with surgery, a good chunk of this brain here, but as you might guess, removing motor cortex, so Britta would be paralyzed on her left side forever. Unethical-ish. Unethical. And then white matter on the other side, if it didn't extend, if it was just the middle part, just this part of your brain that talks to the other part of the brain, would be fine to have lost. There really wasn't much right brain for the left brain to communicate with, so the connection between them wasn't all that important. But unfortunately, a lot of her brain tumor was kind of growing into the part where it chooses to think and reason, and also for obvious reasons you can't like lobotomize somebody. So we took out what we could. So then we debated a long time, hey, do we do radiation? If so, how much and where? And then do we do chemotherapy? And if so, what kind of chemotherapy? How often? Essentially two choices again, the PCV versus TMZ. We chose PCV. We opted to not do radiation because I feel like the risks in Britta's case of long-term outcome outweigh the benefits of her potential benefits from radiation. And there's probably another video I did talking about that. And it doesn't apply to every brain tumor case, and you should always listen to your oncologist and always have a great healthy discussion. Is radiation and or chemotherapy and or nothing appropriate for me? So Britta's case, we did chemo. We did one round of PCV, right? And then we had a problem with the V. So what we did is we just cut that out and done the round of procarbazine and CCNU. And asked, well, how'd you do? So Monday, her scan came back, and essentially, I'll go into too much detail, all kind of the junk that was along these edges, down here, along the side of her brain, like, essentially evaporated. Like, it's pretty favorable. The guy, whoever read the scan was this, the quote was, basically the multilobulated, gross looking tumor stuff on the edges of her resection cavities, where they cut everything out, was no longer visible. And essentially there was just kind of surgical scarring left, which is pretty good to have a response like that to chemotherapy. So thank God for that. The kind of only caveat to that is this stuff that kind of extended into her motor cortex, and this stuff extending into her white matter in her right or left frontal lobe, still present but didn't grow. And there's a challenge in radiology in kind of determining, is this tumor still? Is this scarring from surgery? Is this scarring from dead tumor? Is this a dead tumor? And you don't know. You just don't know. And you'll never know. At least, like biopsying it. Even then, still wonder. So what happens now essentially is you look at this and you say, well, has it grown, right? Because last scan we did was essentially we had like a radiation in question planning that we didn't do. And then we had essentially her surgical scan to compare to. So the radiologist compared to her surgical scan back in September, about 3.5 months ago, and said, hey, has there been any change? And it says, well, there's this kind of persistent hyperintensity, meaning this sort of odd looking stuff, but it really hasn't changed in 3 months, 3.5 months, and for malignancy not to change in 3 months, that's for a cancer that's changed within 3 months. That's pretty encouraging. So where do we go from here? I guess in summary, so a lot of the junk that was in the surgical cavity kind of edges gone. That's spectacular. You can look at her scans and they're nice smooth edges. It's like everything you'd want. And then this kind of old stuff that was extending, hard to tell. Is it dead tumor, old tumor, new tumor, scarred tumor? You'll never know right now. We'll never know right now. But I think it's encouraging that it hasn't grown or changed. So what happens next? Well, we continue chemotherapy. So the traditional amount of kind of cycles, at least in American wisdom, would be doing 6 cycles of procarbazine, CCNU, so PC total, right? So British done 2, so 4 more to go, each about 6 to 8 weeks apart. So we're looking at 6 times 4, so engineering 24, or 6 times or 4 times 8, so 8, 16, 32. So sort of between 24 or 32 weeks left of chemotherapy, on and off PCV, and then we'll scan again after cycle 4, so 4-ish months from now, and see if we're still not growing or receding, which would be better. So I guess ways to pray. So chemotherapy, man, I mean, it's still chemotherapy. Britta doesn't, somebody asked, does Britta need a port? No, she doesn't. PC are both oral medications. That's great. Does she lose her hair? No. They're poorly absorbed in the skin, so we get to keep her hair. The big problems is that you got essentially other rapidly dividing cells, including your GI, but in your blood, you got white cells, right, which fight infection. You have red cells, right, which sort of carry your oxygen to important parts of your body, and you need those, and then platelets, which help your blood clot, right? So Britta's had 2 problems with her chemotherapy. In addition to the vincristine kind of causing some neuropathy, meaning some kind of pain from nerve damage that we had to stop, she's had a problem with low white counts, right, and low platelets. Not any problems with the red cells yet. So with these, risk of infection, right, and then risk of bleeding. Has it been so low that we have to stop the chemotherapy? No. But got 4 more cycles to go, minimum. So it's going to keep taking its toll on Britta, and eventually, I think the white count might get low enough, her platelets might get low enough. You have to kind of ask the question, well, do we delay her chemotherapy a bit? It's plausible. Again, in American wisdom, we just kind of do them as close together as we can to tolerate, to kind of just destroy the cell lines that are her tumor. But there's some other folks and studies in countries that say, hey, you could do it over 2 years, 8 cycles if you wanted to. That would be kind of a more Japanese approach in some of the studies I read, and then different European regimens as well. So there isn't a perfect answer here, but I think big picture, her chemotherapy has produced a response in British tumor that seems pretty favorable. She needs more chemotherapy. She needs to not have side effects of chemotherapy, but she will. But we can certainly continue to hope and pray that Britta continues to do well, and I think we got a good chance of that. So, ways you can pray: Britta's got more chemo coming up. Please pray that she'll tolerate it, and her body will tolerate it, and that it will continue to destroy whatever might be left, kind of floating around inside these areas. And I guess you can also pray that next scan we see some receding of these. That would be wonderful. Or they just evaporate too. That'd be great. Then, I don't know, you can pray for me. I'm back at work doing inpatient medicine. It's hard. I like inpatient medicine, but I also hate inpatient medicine. But I mostly like inpatient medicine. So working in the hospital, it's good to do. And I just need help with it. And then kind of pray for this plan to eventually have a mission-minded residency program for young doctors like myself and others to train other doctors in to go over the seas and save the world for Jesus. So that'd be great. I hope you're all doing well, and I thank you quite a bit, and I appreciate all your help, love, and support. So take care.